Alright, पहले का जो chapter है about the breast, इसमें the heading investigations of the breast symptoms is what we're tackling right now. The different modalities are going to be your ultrasound, फिर X-rays, which in the case of breast is a mammogram. Then you have MRI, फिर you have samples, which can either be cytology or histology. And then there's a large needle biopsy. The concept यहाँ पे is इस तरह से कि one of these things aren't sufficient. You need to have an accurate history, a very good clinical examination done both with the hands of the patient at rest and hands raised. क्योंकि कोई लेन है जो कि किसी फ्लेक्चर पे है जो हाथ ऊपर करने पे फिर prominent होती है या vice versa. And then you need to have, number one was that. The number two thing is your radiological imaging, all of these things which will either confirm or deny your provisional diagnosis. And the third thing, which is equally as important, is the tissue sample, जो कि फिर cytology, histology report से बताएगा कि breast cancer है या नहीं है, etc. So ultrasound is the most non-invasive, simplest, easiest, accessible modality to use. Before I talk about this, let's talk about mammogram या mammography. This is basically X-rays और इसकी जो dose होती है that's इतनी कम कि it is labeled as a very safe investigation in Bailey. When you have young females, they have a denser breast tissue, or that because of that, in them mammography is not as sensitive as it is in females with older age, because in them the density of the breast becomes less. Altogether 5% breast cancers होते हैं वो mammography से pick नहीं होते, so a negative normal mammogram does not guarantee being free from cancer. Ultrasound में we were talking about the density, so basically जिन younger population में mammography is not as sensitive, उनके लिए ultrasound is a very useful tool. We can also use ultrasound to distinguish the cystic from solid lesions and the areas which are impalpable. There, this is a great modality to use. MRI has its advantages as well. It distinguishes DCIS, high grade although, from it doesn't distinguish that, it picks it up, it assesses the DCIS, but only the high grade, not the low grade. It's also useful to assess multifocality or multicentricity, लेकिन वो भी lobular cancer के अंदर ये वाली बात है. कोई भी scar tissue को recurrence of cancer से distinguish करने के लिए this is a good modality. And again, screening tool है in high risk women जिनकी कोई family history है, और इसी तरह the women who have breast implants, उनके अंदर भी MRI is a good modality to use. So needle biopsy / cytology is basically the sampling of the tissue or the lesion. If I get the cells cytology done, so I would be using, this procedure would be the FNAC, or I would be using a 21 gauge or 23 gauge needle. जितना बड़ा number है उतनी छोटी needle है, because आगे हम बात करेंगे 8 या 11 gauge needles की, और वो हम large needle biopsies में करते हैं use. तो इसमें हम क्या करते हैं, it's 10 ml syringe होती है, वो उस lump के अंदर से multiple times pass करते हैं with applying negative pressure, तो it sucks the matter into it, और फिर that gets sample. पहले उसको smear करते हैं उसका, और फिर air dry करते हैं, fix कर देते हैं, and then that gets sent to the lab जहाँ पर फिर cells का बताता है वो. But क्योंकि सिर्फ cells का बताता है, therefore it's not very good way to distinguish between an invasive carcinoma and an in situ disease. और दूसरी इसका जो negative point किया है कि false negatives आ सकते हैं sampling error से, पर जो इसकी अच्छी बातें वो ये हैं कि it's least invasive technique of a cellular diagnosis, it's very rapid, it's very accurate. On the other hand, जो histology है that's done by needle biopsy, and since वो एक core biopsy needle होती है और थोड़ा बड़ा sample आता है, therefore we apply local anesthesia for it, and it's a spring-loaded needle. Core biopsy means that it's gonna take a chunk of that lesion center. And then इसकी अच्छी बात ये कि it will differentiate between DCIS, and it will also tell you, and the invasive disease, and number two, it will tell you about the receptor status of the tumor. Large needle में हम उससे भी बड़ी bore की needle use कर रहे हैं 8 या 11 gauge, and that it takes more volume basically, and that is helpful in the management of microcalcification of fibroadenomas की complete excision के लिए. सो दैट्स प्रीटी मच इट. ट्रिपल असेसमेंट की हमने बात की थी कि कोई एक तरीका सिर्फ अकेले हम डायग्नोसिस के लिए काफ़ी नहीं होता. It's best to have a good clinical assessment and radiology supporting your provisional diagnosis, plus a lab report confirming your diagnosis.